So we're going to discuss some treatments that we can do for hypomobility of the posterior interosseous nerve and de Quervain's tenosynovitis. Um, so depending on if there was a surgery or not is going to impact how I perform my treatment. Obviously, in this case, there was no surgical approach. So what we're going to do initially with that is we're going to probably immobilize it and put it in some type of splint. Um, After the period of immobilization, well, during the period of immobilization, we're going to be doing, which is typically going to be 2 to 3 weeks, we're going to be doing just typical range of motion exercises. Um, Nothing resistance, no resistance added yet to this point. So once we get rid of that brace and we start to see a reduction in pain, is when we're going to start hitting um, the active strengthening activities. So the first thing we're going to do is a stretch for the posterior interosseous nerve, which I'll teach my patient here. So all I'm going to do is have her fully pronate her arm like so. Just going to take your other hand and then bring the wrist fully flexed like so, and then bring the arm down until you feel a stretch right on the inside of your thumb here. So I instruct my patient to hold that through. Do 3 sets for 30 seconds there. The next thing we can do is, this can be for the deeper veins, stretching the tendons there. We're just going to do a thumb opposition stretch. So all I'm going to do is have my patient, within the constraints of pain, just start at the index finger and then move her way all the way to the pinky, and then hold that, trying to touch the tip of the thumb to the pinky as far as you can over there. Same thing, 3 sets, 30-second stretch there. Now as we move into strengthening activities, I'm going to have her grab a rubber band. This is going to be essentially for the thumb. So we wrap the rubber band around all the fingers like so. And we're going to do 3 sets of 10, extending all the fingers like so. Really targeting the thumb, but we're hitting other muscles in there as well. And then we can further progress to, we're probably going to be about 6 weeks out now. This, if I can remember correctly, this person did a lot of heavy lifting, so we want to mimic some of the job functions that we do. So with a hammer, we'll pretend this is a hammer, but essentially what we're going to do is work wrist musculature. So we're going to be working wrist flexion, we're going to be working wrist extension, radial deviation, and ulnar deviation. So I'd have my patient do that with the hammer each direction, 3 sets of 10, to work on strengthening those muscles around the impairments.